Hello, professors and fellow students. This is a video recording of research on evidence-based practice on the following topic: alcohol-based antiseptic or soap and water hand wash in patient care setting. So from the beginning, I would like to clarify these two terms that I may use interchangeably throughout the presentation, and that would be alcohol-based sanitizer, which I may refer further on as if sanitizer or waterless alcohol hand sanitizer. Hand washing will imply scrubbing the hands using both soap and water. So just keep that in mind for now. Now, you will ask me, why did I choose this topic? And working in the hospital setting, I started noticing that throughout the hospital, and not only on the floor where I work, I have noticed that more hands-free mounted sanitizers are in each patient care room. And that triggered the question in my head: is hand washing not enough? Is it more efficient, sanitizers versus hand washing? Or which one is better? For that reason, I started to search the topic. Throughout the research, I wanted to state that I have learned several new things, which one of the most important one is that World Health Organization at the meeting in Geneva in 2011 has stated that nosocomial infections account for annually more than $6 billion of governmental loss in United States only, and greater than 7 million euros in Europe. That's quite tremendous. Another fact that I just learned is that CDC in Atlanta in 2011 on recommends using hand sanitizers more often than hand washing. However, it does not imply the fact that hand washing is less effective than sanitizers. So that's interesting to know as well. So let's dive in and see what is the actual picket question that I used throughout my research. So that'll be: is hand sanitizers, which is the intervention, more effective in reducing nosocomial infections, which is the outcome, rather than using hand washing, which is the comparison, used by healthcare providers, which is the population interested in care used towards the patients that are admitted to the hospital, which is the time. So let's go ahead and see what are the tables of research, the databases that I have used throughout this time, and compare them just quite a bit for you to have a clear understanding why did I choose the 4 articles that I will be talking about later on. The first database I use is the Cochrane Library, and you can see that I have used several search terms throughout my search just to kind of have an idea what studies have been done in regards to hand washing, nosocomial infections and the hand wash, sanitizers in healthcare, alcohol sanitizers and nosocomial infections. So pretty much a combination in between sanitizers and nosocomial infection, and also hand washing and nosocomial infections. The most articles I have found was hand washing, and that is quite a number, 10,249 articles, and then I understood I have to refocus my search in order to narrow it down to what interests me the most. What I have learned that throughout the past 10 years, I have actually found the most relative research trials and experiments, qualitative research that have greater findings. From this database specifically, I have pulled one of my articles that actually is one of the two that interested me the most, and I'll get back to it. The author is Meliakal. Let's go to the next one. And that's still a continuation of the research finding table. As you can see here, I used Sinan Hall, another database. Same researched terms: hand washing in healthcare, alcohol-based antiseptic and nosocomial infections. And I basically wanted to see within 5 years what research has been done so that it's more relevant to today's practice. From here, I pulled one of my first articles I will be discussing later, and that's Giro 2017. And the third database I've used is PubMed and CBI, which I must say I had the most I have found the most relevant articles so far, even though there were fewer than relatively to the other databases. So with nosocomial infections, with no limits, I have found only 4 articles. But then when I start looking at the sanitizers with several limits, I have found the 2 articles that interested me further down the road. So let's go ahead and see what articles I pulled and what am I using in reference to the PICOT question. So for that reason, I'm going to have a closer look to the table, and I will be following that with you as well. So on the very top you see my first article, and that is called Efficiency of Hand Rubbing and Alcohol-Based Solution versus Soap and Water Before and After Patient Care. So the authors are part of an infection control unit at the French University Hospital, and that included a quantitative descriptive research and 23 healthcare workers that happened to work at 3 different intensive care units. So the intervention in this study was hand rubbing with alcohol-based sanitizer and hand washing with soap and water before and after patient care. After that, the imprints of the fingertips were taken, and then they had compared whether there was less or insignificant amount of bacteria count on the palms and fingertips of the patient care health workers. The results of this study are quite impressive, and I must say that with hand sanitizers, they had found that there was a bacterial reduction of 83% versus with hand washing, which was 58%. Now note that both techniques were used using at least 30 seconds per each technique. So let's move on, and I will talk about the article with the author named Chatfield, dated in 2016, and this article name is Experiences of Hand Hygiene Among Acute Care Nurses. This is quite a different research, and that's called a qualitative one. I did wanted to understand what were they looking for besides statistical data. The authors themselves have stated in the article that they were not looking at the generalizability of the findings, though as much as what is the understanding of the healthcare workers, primarily the nurses, since mainly the nurses were included in the study, about the sense of hygiene, cleanliness, and what are their perception about germs and bacteria, contamination, and so forth. 8 nurses at various hospitals throughout the United States were used in this research, and they have been asked several questions about their perception of seeing their hands or themselves even clean. For that reason, you will see that I have used quite some variables here, such as practical hygiene, which is a term used by the nurses in this research study, risky business, and hygiene on trial, which I will go ahead and talk about a little bit in depth here. Practical hygiene. So 2 of the 8 nurses have stated that they see themselves what they called old-fashioned, and they feel that hand washing with soap and water is more effective. But that is only their perception. They did not say that they do not like or they do not accept the hand sanitizers in healthcare services. However, they prefer to have soap and water as the technique to use by themselves. Risky business. This term appeared to be in relation to the cleanliness of themselves, how the nurses perceived their own body after interaction with the patients. So it wasn't only the hands that they looked at contamination, but also their clothes, their hair, their whole attire. What did they state was that they feel that hand washing is not enough or hand sanitizer use is not enough. They feel they need to leave their clothes and shoes right before leaving the hospital so that they don't bring this bacteria, germs, and so forth to their house. So that was the risky business that some of the nurses have disclosed to the authors of this article. Hygiene on trial. Several nurses have stated that they do not know whether hand washing is better than hand sanitizers. However, they acknowledge that there is a new trending in use of the hand sanitizers. And they believe, without any evidence, that it's better to use the hand sanitizer. So as you can see, this data is relevant because nurses and in general healthcare practitioners may see hygiene in total different aspects. So it's not only about the hands, but it could be the whole body. Now, what we learned overall is that alcohol-based sanitizers was pretty much viewed as coating rather than cleaning of the hands. And the findings of this article encourages the nurses to use actually periodically soap and water after several uses of hand sanitizer. It's pretty much straightforward. Let's move on and see the next article. The latter 2 articles are actually the ones that I have based my findings about sanitizer versus hand washing, and I like these articles the most, and I will tell you at the end why. So Larson is the next article, one of the authors, and The name of the article is called Effect of Antiseptic Hand Washing versus Alcohol Sanitizer on Healthcare-Associated Infections in Neonatal ICU Settings. So the reason why I like this research mostly is because, first of all, it's experimental. So that gives me statistical data based on the research question. There were 119 nurses randomly asked to participate in the research in 2 different neonatal ICU settings. And that happened in Manhattan, here in the United States. So what they did is they basically asked these nurses for 11 months to use either hand washing or hand sanitizers throughout this period and then change it to the other technique. The duration of this study was 2 years. At the end of this research, what they found out is that the infection rates and the microbial counts were equivalent during hand washing and alcohol phases. The next one, which is actually interesting, is that nurses' skin condition was improved using the alcohol sanitizers. And lastly, there is no difference in between hospital-acquired infections among neonates during the 2-year period of random product use. So what this tells me is that basically the nosocomial infections, if using the either technique or both interchangeably, will still work towards reducing the nosocomial infections. The CDC, also discussed in this article, recommends to use the alcohol-based hand sanitizers for patient encounters and to wash hands with soap and water only when hands are physically soiled. So that is a good point to learn. The last article I wanted to discuss about is Meliakel 2005, and it is called Comparison of Traditional Hand Wash and with Alcohol Hand Drop in ICU Setup. Now, this experimental research type was conducted in India, not in the United States, at the Chetram Hospital and Research Center by a group of employees who are responsible for infection control. Now, what they have done is they asked 34 nurses in ICU settings during several months in 2003 to have their fingers imprinted before going into a patient care room and after the intervention of physical touch with patient care. So the imprints then were used to actually build the colonial populations on the agar plates. Now that gives us a statistical data about the exact amount of bacteria used. So what they found is that before using either technique and entering the patient room, there was roughly around 92% of bacteria on hands on either employee that was tested in this trial. Now, after the use of hand wash, after patient care, there was a reduction in 50%. Now again, this was with hand wash, and up to 95% after use of alcohol hand rub. So what that tells us is, again, sanitizers is showing a higher efficiency in reducing bacterial count on patient care hands. In conclusion of this article, I could say that alcohol hand sanitizers are more efficient and are time-consuming, less efficient than using wash. And we know that hand washing at least takes 30 seconds, good scrub in between the fingers and nails to achieve a higher decontamination. And that brings us to the next set of conclusions. So overall, I wanted to bring up again the fact that CDC recommends us to use soap and water only when hands are physically soiled, and all other encounters, healthcare workers shall use the alcohol-based sanitizer. Also, hand rubbing with hand sanitizers is more efficient and is less time consuming, as I just stated earlier. Hand sanitizers is also better for skin, apparently, which I never knew. So this is what I've learned throughout this research. I hope I have given you some good information as well. And I think that there should be still done more research on this question, and specifically the difference between hand washing and hand sanitizers in reducing the nosocomial infection in patient care setting, because, as you remember the literature research table, I have found less articles within 5 years than it was with no limits or within 10 years. And these are the references of the articles I have used throughout my research. I hope you can see them. And if you have any questions or any comments, I would love to hear them after you see this presentation. Thank you, and hope to hear from you.